Hi, I'm Dr. Ling Liang. I'm an optometrist in Toronto area. I also do developmental and rehabilitative optometry, so I do vision therapy to help those kids who has those problems. So the more obvious problems are the ones who has crossed eye, so the eye turn out or turned in. The other problem is lazy eye, which is one eye seeing better than the other eye, even though you give them the photo prescription. And that some people say it's hard to train after age 9, but it could be done with vision therapy. And then the other smaller problems are anisometropia, which is one eye's higher prescription than the other eye. So it also leads to lazy eye as well. They work together. So for example, one eye is -9 and one eye is -1. It's really hard for the eyes to use glasses because one lens will make the image bigger and one will make the image smaller, and they cannot merge those two images. The other smaller problem is the convergence insufficiency. The eye is not able to converge together when they're looking at something at near, whereas far they should be parallel, but if they cannot converge, it's harder for them to focus at near for a long period of time. And also accommodative insufficiency, which means they cannot zoom in and out as effectively, especially zooming in, and they may not be able to sustain it. We also have something called accommodative infacility, so which means the zooming part is kind of needs twitching. It's not zooming really smoothly. Imagine two pairs of camera that they're supposed to zoom at the same time and zooming back, but they are not zooming really easily, or like one is caught halfway or one is getting clunky. So that's what happens when your eyes are supposed to work together and they're not working together. So vision therapy is a really good way to help treat those, make sure that they are rid of the symptoms such as attention deficit, poor focusing, skipping lines, not able to read small prints, and giving up reading, using hearing instead of reading to learn, or distracting other people in class, people being really touch everything to learn instead of using their eyes to learn. So those are all symptoms of binocular vision disorder, and they could be helped. So in the future, I'm going to talk more about each of those in detail and the vision therapy that could help them through.